So the Guardian Advocate program in its most basic form serves individuals who are over the age of 18 that have been psychiatrically admitted to a hospital for evaluation for harm to themselves or someone else. And during that hold or 72-hour period, if they don't have somebody that can make medical decisions for them in their psychiatric care, they're assigned a Guardian Advocate through a magistrate. So who is a Guardian Advocate? Well, the Mental Health Association recruits volunteers to be a part of our program to go out and advocate for these individuals that are in the hospital. They have to go through a 4-hour certification training program that our team administrates and make sure that we go over all of the rules and statutes that apply to what are their obligations legally, because they are appointed by a state magistrate and defended by the state attorney and public defender. And while they're there, they could be somebody that's going through their master's program at a UCF School of Social Work and wants to understand and get some real life experience. They could be a retired healthcare professional that wants to just still stay connected, or they could be a family member who has somebody that has severe mental illness and they want to be able to help that. So it's important for me to stay connected to the clients and patients that we advocate for. So I also am a Guardian Advocate. And I particularly remember a case last October of a woman who had been brought into the hospital and needed an assigned Guardian Advocate. She and her husband had made a suicide pact, and he was successful and she was not. And she believed that she killed him, which of course was not true. And she was in the hospital for an extended period of time. And one thing that's not really recognized is when you come into a psychiatric facility, some of the things that you think are just everyday items are not permitted because of safety. And when she came in, she was wearing a pair of laced sneakers, and those were unfortunately taken from her. And on one meeting that we had together, I said, "What would you like if you need anything?" And she said, "I'd really like to stop wearing these sock slippers and get a pair of shoes." And so I went online that night and I ordered a pair of Skechers slip-ons. And it was really moving and poignant because it was like she was getting something that was incredibly valuable. And while it cost about $35 on Amazon for a pair of slip-on Skechers, for her it was all the money in the world to bring her something that humanized her and made her feel like she was on a road literally to a recovery. So I think about her often. She's not in the hospital anymore, and she is on that path. And it's very important to me as the leader of the organization and as somebody that's worked in the community to remember that these are people and human beings, and we sometimes forget that. So the support at the Mental Health Association that I frequently talk about is completely through philanthropy. We don't charge any services, not for placing a Guardian Advocate, for the Outlook Clinic and the services that are provided there, for the classes and support groups at Reflections. All of the services are free to anybody that might need them, which means that we have to go out and ask for donations. We have to solicit to foundations and companies to help support our programs because they're run by people. So the Guardian Advocate program is no different. One of the ways that we recruit volunteers is for every client that they agree to work with, they can get a $50 stipend. That offsets their cost of mileage and gas so that they can get to the facility. Some of them are far out, and it just makes it a little easier to offset those costs. So for every $50 that we raise, that's a Guardian Advocate that can go to see a patient in a psychiatric facility.